Hi there. I know it's been a few months since I've checked in. I apologize for those that may be following my thread, wondering how I'm doing. Just been kind of busy. It's June, and it's been 7 months since I've had my prostatectomy surgery, and I've had two 3 month follow ups where my PSA has been zero point 0.1, and also, I had a follow up of my PCP, my primary care physician, and my PSA was zero point zero 0.01. And what I was told is that it was just a matter of what lab is being used. And some labs, it'll come back as one number, other labs will come back as another. But in general, it just means it's negligible. They're not seeing the PSA, and everything is so good for now. If my PSA level gets to zero point 0.2 or higher, then they'll start looking at possible treatments, and they'll just go from there. So things are good in that area. Incontinence, yeah, it's still there. Um, you know, I guess what I want to say first is that even though I watched a lot of videos about incontinence, I spoke to a lot of people about incontinence, and read up on all of the pads and underwear. I don't know that one that a person can ever be truly ready or prepared for what that means for dealing with incontinence. You feel like you're fully prepared, you're expecting to leak, but then when you start getting, better after the surgery and the pain starts going away and you want to start going out and you want to start feeling normal and go to a restaurant, but yet you start leaking. Um, for me personally, it was uncomfortable. Um, so frustrating at times, and just it. I don't know. It's just a very emotional, personal thing to deal with the incontinence. Um, even in intimacy, and I'll touch on intimacy here a little bit more in the video. But the first couple of times leaking, it's embarrassing. So it's a tough thing to deal with. But what I can say is that in 7 months in, it's gotten better. I'm no longer really needing the thicker pads. I use the thinner ones for the most part. A couple times I've just used the protective underwear without a pad. That's been nice because it's a little more comfortable. And, to get through my stock, obviously, I've been putting a thicker pad in the evenings. Although I don't really find myself leaking at night, so that's pretty nice. I will tell you, though, that the urination in the evening times or at night when I'm sleeping, I'm still getting up 3 to 4 times to go pee. So I still have to monitor how much I'm drinking before I go to bed. If you're going to have an alcoholic drink, or if I'm going to have one, I try to drink it a little bit earlier, and just to kind of do what I can to keep from having to pee as much. There's been a couple times where I've been so tired that I do go through the night only getting up 2 or 3 times, but I generally don't find that I have leaked. And so that's an improvement. It's better. It's helping with my emotions. And yes, if you're curious, it's gotten better during intimacy. And again, I'll talk about that here in a minute. So the underwear itself, there is a couple of caveats that I just want to kind of put out there. That if you're a man and you're wondering what to expect with it, so I had my surgery in November. Winter time comes, and you started going out, no issues, right? So we get to spring, and here it is. Summer's just a day or two away, and I've gone hiking. I've done yard work, worked in the yard, and I can tell you they act like a sponge. And it gets a little sweaty down there. And yeah, I found that I've had to go at times where I just went in and changed out my underwear, changed out the pad just to feel a little bit better, go back out, finish doing my yard work, and then, of course, get another new one in the evening after taking a shower. So I just want to put that out there that, if you're there, you're experiencing it, yeah, it's just a kind of a side effect, I guess, but it's not terrible. I mean, I'm not soaking my clothes per se. It keeps all the moisture within the protective underwear, so that's, I guess, you could say it's a good thing. Medication, yeah, I'm still on tadalafil, which is the Cialis' generic medication, and the doctors have said that it's essentially for blood flow. They want to ensure that it's not just about getting blood into my penis. Excuse me for a minute. In my little bit of a dry throat, but it's for to ensure that I'm getting blood flow to all areas down there. As I remember, when they took out my the prostate, they took out the nerve packages, etc., that are down there, and so they're hopeful that some of the blood flow that'll go in there will just help what remains, I guess, in that area. And there is a new item that the doctor prescribed and asked for us to start using or trying, and it is a pump. It is a new thing, and I didn't know a whole lot about pumps, to be honest with you. I maybe I've heard the term before and maybe just thought it was a thing for sex only. And the way the doctor explained it to us, he said that intimacy is a component of having the pump, but he said the therapy and the getting the blood flow and the blood circulation is the other portion of having the pump. And in the beginning, when we first had it, they really wanted me to do it about 4 to 5 times a week, and then of course going into intimacy. And then more recently, he said now we can probably scale it back to about 3 to 5 times. I'm sorry, 3 to 4 times a week, and that's outside of using it when we're getting intimate. Okay, so intimacy. Obviously, I don't get an erection, and it's that'll never happen again on its own. So intimacy, as I mentioned earlier in the video, um, it's what I can say is that yes, it is different. The sensitivity is different, and how your how things come together and what you're going to do with your partner is different now. But what I can encourage you to, or my encouragement to you would be, is that give it time. The first couple of times, because the things are so different, maybe you're leaking, you get frustrated maybe, but it doesn't mean that you give up. And that was our mantra, and that's what we went through. And I can tell you that I got a great wife, and it's she's got a lot of patience, and the Lord has blessed us in that sense that now intimacy is a lot better. Um, okay, so if you're a male, you're watching, you just want to know, does the pump help? Doesn't know. Um, yeah, okay, you have, I guess, an erection, if you wanted to call it that. But, the first few times it's like, yeah, it's just, I don't know, it's just different. It's difficult to explain, and I don't know that, how to put it in words to where I can say that, what it was really like going through it. But I can tell you now, if we go in if the pump is part of our intimacy, it's definitely much better. Um, but the I guess I don't want to go into too much detail. This is a YouTube video, and it's a very personal thing for me, and my wife. But I do want to at least share it at some level, because I know that before I had my prostatectomy surgery, I wanted to know what men were going through after their surgery, and what was it like the first time that they had intimacy. So I want to share it at least at that level. So that's really all I got to share for today. Again, I'm going to try to do videos more often, and especially when I get my next PSA, I'll check in with everyone. But hope everyone's doing great, and have a great summer.